Hello, I am Dr. Charles Gardner, Medical Officer of Health for the Simcoe Muskoka District Health Unit, here to provide you with the COVID-19 update for Simcoe Muskoka. So as of today, we have 7,658 cases, which is up from 331 a week ago. I last reported on March the 23rd, just to give you the scope of how things have changed and from when. If we look at a week-on-week change, and we look to the week that began on the 21st of March, we had 307 cases, which is up by 18% from the week before at 261 cases. So there has been some increase over the past 2-week period. If you go before that, the week of the 7th of March, we had 301 cases. And then the week before that, beginning the 28th of February, we had 212 cases. So basically a kind of a sawtooth pattern of kind of an up and down pattern of change that we're seeing over the last few weeks. If you look to the week of the 14th of February, the 14th of March, that's actually 2 weeks following being in the lockdown. And the fact that the cases were down a bit in that week might be reflective of the control measures that we put in place 2 weeks before. So basically the cases were going up and then they came down during that week, and now they've gone up again. At this point in time, we've had an increase in the total number of active cases. So we have 459 active cases, which is up from 429 a week ago, and 6,918 recovered cases, up from 6,637 a week ago. We've had a total of 198 people who've passed away from COVID-19. This is up by 3 since I last reported, and I would like to express my condolences to the family members for your loss. These people are as follows: a woman between the ages of 65 and 79 from Simcoe County, a man 80 and more years of age from Simcoe County, and a woman 80 years and more from Simcoe County. We have 32 people who live in Simcoe Muskoka who are now hospitalized with COVID-19. This is up from 23 a week ago. And we have 9 who are in the intensive care unit, which is up from 6 cases in the ICU a week ago. The ages of these people range from in their 20s to in their 90s. 28 of them are sporadic cases and 4 are related to outbreaks. We're noting that there's some impacts with regards to age, that in March we had a younger age group that were affected compared with previous months. So March, the average age of cases was 37. In February, it was 38. In January, it was 43. Keeping in mind that in January, we had some very large institutional outbreaks that involved a large number of senior citizens, older people. Today, we've had, in the past 24 hours, 32 additional cases. They're all sporadic. 18 of them are male, 14 female. All of them live in Simcoe County. 1 of them is community acquired, and by that we mean we don't know how they acquired it. 4 were from close contacts of known cases, and 27 are under investigation. All of them are self-isolating. The vast majority of our COVID cases in Simcoe Muskoka throughout the pandemic and recently have resided in Barrie, Bradford, West Gwillimbury, New Tecumseh, and Innisfil. And these are the municipalities in which we've had the highest incidence of cases for the week of March the 21st. So Bradford, West Gwillimbury, 158 cases per 100,000 population. which is up from 105 a week ago. New Tecumseth at 106 cases per 100,000, up from 75 a week ago. And Barrie, 72 cases per 100,000 population, up from 70 cases a week ago. And Innisfil, 64 cases per 100,000 population, which is actually slightly down from 66 a week ago. In terms of our educational settings, since February the 8th, when schools opened, there have been a total of 163 cases in staff and students in educational settings, and this is up from 135 a week ago. It's important to note that the great majority of these weren't part of outbreaks in schools, rather they were cases acquired in the community that then resulted in exposures in schools. So 80% of our cases were in elementary schools, and 20% of the cases were in secondary schools. And 34 of these cases were related to outbreaks, which is up from 32. Sorry, I'm going to say that again. 36 of these cases were related to educational setting outbreaks, up from 34 a week ago. And 11 cases have occurred in childcare settings among staff and the students, the clients, which is up from 7 a week ago. In terms of the COVID variants of concern, we now have had a total of 1,232 cases, which is up from 1,045 variant cases a week ago. These are cases that have screened positive or have been further tested to identify which variant of concern they are. And so the variants that we've had are consisted of those that are the B117 variant, the P1 variant, the B1351 variant, and those that have just screened positive without identifying which variant we are dealing with. 97% of those have been located in Simcoe County, 3% in Muskoka. We've had an increasing trend with regards to the percent of our COVID cases that are variants of concern. So for the week of March the 21st, 86% of our COVID cases were identified as variants of concern. We have 6 active variant of concern outbreaks at the moment, down from 7 a week ago, all of them located in Simcoe County. 3 of them are in workplaces, 2 are in educational settings, and 1 is in a congregate setting. If we look at all of our outbreaks, both with and without variants, we now have 12 outbreaks, down from 13 a week ago. And half of those, 6 of those, are outbreaks that are from variants of concern. So 4 of these outbreaks are in institutional settings, which is up from 1 a week ago. So we have 3 new ones at Mill Creek Care Center, long-term care facility, IOOF, long-term care facility, and Levita Barrington Retirement Home. We have 1 congregate setting that is new as an outbreak. There were none a week ago, and this is a group home in Simcoe County. And we have 3 workplaces, which is down from 7 a week ago. So 4 that are declared over, 1 in a retail in Simcoe County, 2 food premises in Simcoe County, and 1 manufacturing in Simcoe County. And we have no community settings with outbreaks at the moment, which is down from 1 a week ago. So declared over within the past week was an ambulatory health care service center in Simcoe County. We have 4 educational settings that are an outbreak, which is unchanged from a week ago. So 2 new ones and 2 declared over. So of the 2 new ones, 1 a child care center in Simcoe County and another Boyne River Public School. And declared over an outbreak at Our Lady of Grace Elementary School and Holy Cross Public School. In terms of COVID vaccination, to date, we've administered 89,600 doses, which is up 19,000 doses from last week. This includes some 18,048 individuals who received 2 doses of immunization, so they're fully immunized. And among our vaccines, we've also administered through primary care family health teams 4,400 doses of Astrazeneca vaccine. We've managed to immunize a very large proportion of certain populations. So to date, we've immunized 74% of people 80 years of age and older in the community. And we've managed to provide bookings such that the great majority of people, almost all people who are 75 years of age and older in Simcoe, Muskoka, have either received their first immunization or are booked for it. We, as I've indicated before, have provided first dose immunization for 95% of the residents of long-term care facilities, 76% of the staff in long-term care facilities, 91% of the essential caregivers for long-term care facilities, 97% of residents in retirement homes, 88% of staff in retirement homes, and 87% of essential caregivers in retirement homes. Have also provided first dose immunization for 67% of hospital staff and 63% of other healthcare workers. And 91% of residents living in congregate settings that provide care for seniors. In terms of our dashboard, and this is different from the province's framework, this is the dashboard we have for ourselves as a health unit. We remain in red status, which is unchanged from a week ago. And this is because of the continuation of viral spread and containment in red, laboratory testing in yellow, in part because of a higher percent positivity at 4.1%, which is up from 3.3%, and laboratory turnaround times that actually are favorable, both exceed the goal of turnaround time of 60% for 1 day and 80% for 2 days. So that would be improvement. Our health system capacity remains in yellow, and this is because of an ICU bed occupancy right now that is 69% overall. And because of high acute bed occupancy, which is 83.3%. In terms of the provincial dashboard, we are in a red control zone, and our numbers are reflective of being in the red zone. Our testing volume is actually up a bit from last week at 180 tests per 10,000 population. A week ago, it was 169. And we do note that there's some difference between Simcoe County versus Muskoka on that metric, with Simcoe County being 192 and Muskoka being 92. But this is actually up for Muskoka, which had been at 70 a week ago. And that overall, we're slightly below the provincial testing rate of 233 tests per 10,000. Our percent positivity is up at 4.1%, up from 3.5 a week ago. We note once again that in fact we're at the provincial rate. The provincial percent positivity is 4.0, and throughout the pandemic we've generally been below the positivity for the province. So this would be noteworthy that we're now at the same rate as the provincial rate. In terms of our trajectory, we have a weekly incidence of 51.6 cases per 100,000 population per week over the last week, compared with 43.9 cases per 100,000 population over the week before. And this puts us at slightly over half of the incidence for the province as a whole. So the province is now up to 97.7 cases per 100,000 population, and up substantially from last week at 75.6 cases per 100,000 population per week. So that's a 29% increase for the province. It's worth noting that a month ago, we were almost on par with the province. So the province has gone up quite substantially while we've been going through that zigzag sawtooth pattern of cases, not substantially jumping up, but going up and down slightly. Our reproduction number is 1.3. So anything above 1 means that the pandemic is growing here. And last week it had been 1.0. And our doubling time has decreased to 121 days, which is down from 151 days a week ago. So this Monday, as of yesterday, the province had indicated that individuals living in Simcoe, Muskoka, who are 70 years of age or older, or born in or previous to 1951, would be eligible to book to receive immunization in Simcoe, Muskoka. I've already indicated that we're very close to 90,000 people who have received immunization to date. And we'd actually started pre-registering people last Thursday for bookings for 70 and above. So, we're very happy to be able to move on to this age group and look forward to being able to move to 65 at some point in the near future as well. We do want to indicate that we're working 7 days a week in our clinics. We have a total of 13 clinics spaced out, different ones operating on different days, but always having something operating. And so this will happen through the Easter weekend as well. Today we have 6 clinics operating in Barrie, Bracebridge, Midland, Wasaga Beach, Alliston, and Orillia. We are also commencing with our partners immunization for individuals who are homebound. This had been a challenge before in that we didn't have vaccine or authorization to use vaccine in a way that would allow us to move in this way, but we now have authorization to provide Moderna vaccine for home visits by drawing up individual syringes to facilitate this happening. We're working with paramedic services in Simcoe, in Muskoka, with home and community care services, and with Barrie Family Health Team in order to be able to reach people who cannot leave their home in order to receive immunization. Of course, focusing on those who, of course, meet the age criteria or have other criteria that would make them eligible at this time to receive immunization. As we look to the future, we're really, I think, commencing the phase 2 requirements for individuals to receive immunization. So we're getting ready to move in 5-year increments into younger age groups. We are getting ready to work with our hospitals and family health providers, primary care providers, with regards to immunizing individuals with highest risk and high risk health conditions. We are preparing to provide vaccination to the residents, essential caregivers, and staff in high-risk congregate settings. So to date, we've been doing those that provide services to older people, to seniors. We'll be moving on to providing vaccination to other types of congregate settings, homes for shelters for the homeless, for example, or correctional facilities, or group homes, other types of facilities. So we're getting ready to do that. And we're getting ready to provide additional immunization in what are called community hotspots, or communities that have had particularly high immunization rates. And in those communities, we would be able to work in decreasing ages down to those that are 50 years of age and older. So getting ready to do all of that. All of that is in keeping with the contents in phase 2. And then following that, we would be working to provide immunization to a very large group of people who are at risk with health conditions, and those who are deemed to be essential workers who cannot work from home. In terms of the education sector, they do fall within essential workers, and that's we would be following the provincial approach as to providing them with immunization later in phase 2. And we are looking at whether there are individual members in the education sector who are at added risk because of the type of teaching role that they provide, providing close interaction with a reduced ability to use personal protective equipment, providing potential healthcare services or direct personal support services for students with special needs. So that is something that we're considering, as are other health units across the province. We anticipate getting more Astrazeneca vaccine. So we, as a district, we're receiving Astrazeneca vaccine in order to provide to primary care practitioners, to provide to people who are between the ages of 60 and 64. And that was meant to be a pilot. We were one of 6 health units that were participating in this. We had very good success with it, and have, via that means, immunized 4,400 individuals. And we do anticipate that there will be more of this, another shipment of vaccine, AstraZeneca, for that purpose. We also anticipate that it would be for those who are 60 and above. We are certainly well aware of the announcement from the National Advisory Committee on Immunizations, as well as from Health Canada, that the AstraZeneca vaccine be only provided to people who are above 55 years of age. And this is because of data and experience in Europe that has suggested an association of this vaccine with people who are under that age group, under 55, with clotting or potential bleeding associated with that vaccine. So I understand that Health Canada is at this moment in time putting a pause on its use for those that are under 55 while they review the situation or review the evidence on this topic. I'm happy to indicate that we have had success with providing clinics for vaccination for the Indigenous population in Simcoe, Muskoka, working in partnership with Mamaway Primary Health Care, Chigamik Community Health Center, and Beausoleil Family Health team. And we were able to provide a vaccine clinic for Indigenous adults 16 years of age and older and their household members last Friday in Midland. The day began with the community elder blessing the vaccine, a smudge ceremony, in the drug circle. It was a very successful clinic, and the health team that vaccinated 398 people. The clinic will also be held today in Barrie. And of course, all Indigenous people can come to any of our mass immunization community clinics by booking through our Health Unit webpage. Looking ahead to Easter, I think it's very important that people not let your guard down. We have noted in the past with holidays that family gatherings and social gatherings have resulted in a measurable increase in transmission of COVID-19. And so it's really important that people keep that in mind and find ways to be close with family and friends that don't put people at risk. So using remote means of being together is always safest. Doing so outdoors is much safer than indoors. People have to be mindful of the gathering limits, no more than 25 people for an outdoor gathering, and that they need to maintain the physical distancing of 2 meters and use face covering and mask if you're not able to maintain those distances. I really advise people not to have individuals indoors for such occasions. But if you do, you need to be maintaining the distancing and the mask use, and no more than 5 individuals. And you need to be mindful of hand hygiene and washing, and self-monitoring and exclusion from any kind of gathering if you are developing symptoms and seeking medical attention and testing. So I have the following media questions. Tourism season is almost here. Are there any new measures the Health Unit is planning or expecting from the province when it comes to operating local businesses to keep our case numbers down? So I would say that people need to be mindful of the overall recommendation from the province that we only travel for essential purposes. People need to be mindful of the restrictions for gathering limits and recommendation that you not have people over except for your household members, or for those that live alone, that they have one other household that they abide by. We certainly will work with our businesses to keep them operating within the requirements of the province's legislation, and that if necessary, enforcement would be done. We rely very much on goodwill for businesses to be able to operate. I think we need to keep very close contact with any changes that the province identifies that they want to make further to the framework. At this point in time, beyond the letter of instruction that I've already put out to businesses for safe operation, we aren't contemplating any changes at this moment or any further orders. How many people in Simcoe, Muskoka have had the Astrazeneca vaccine? So that I've already touched on. 4,400 doses have been given. So how will the change in its recommendation for use only over 55 impact distribution plans going forward? So I do not believe that there would be an impact, in that it was being used for older people anyway, people 60 and above. And so that would not require a change. The restriction of over 55 would not require a change in that practice. Will the Astrazeneca vaccine be offered through family health teams and pharmacies to anyone over 60, or still just the 60 to 64 age group? So my understanding, it is now for those that are 60 and above. And we do anticipate family health teams here continuing to receive vaccine through ourselves. Look forward to getting more vaccine. We don't know how much vaccine that will be or exactly when it will be coming. We have been informed that the province will be expanding the number of pharmacies that will be receiving AstraZeneca vaccine to a minimum of 3 pharmacies per health unit. We don't know which pharmacies at this point or when. when and which pharmacies in Simcoe, Muskoka will be getting the vaccine, we don't know at this point. Do we have a waitlist option? So if there are no shows or partial vaccine vials left at the end of the day, you have people to call. Can anyone get on a list like that? And my response is we are prepared to ask people to come in to receive vaccine at the end of the shift, people who haven't been booked as yet, because we do need to use up vaccine that has been reconstituted. Otherwise it expires, and we've had good experience with that and been able to keep up with that. And what we do is draw upon those who have already pre-registered on our system, and therefore they do, by definition, fall into the priority groups to receive vaccine. So we use that list to call people back. Why vaccinate work from home healthcare workers before those with chronic health conditions, those in their 60s, or essential community workers like grocery clerks? So I would say that that's a good question. And in part, it is something that is in keeping with the province's framework. So we are following the framework with regards to phase one, focused to a large degree on healthcare workers, and divided them into highest priority, high priority, very high priority, and then moderate priority, medium priority. And the medium priority individuals were to be at the very end of phase one or the very beginning of phase two. So as a health unit, we have complied with that while also proceeding, working through the other priority groups and proceeding with those that are 70 and above. So those 70 above and 75 and above were meant to be addressed within phase two. We've proceeded with that as well. So we're doing concurrently more than one group, but we are abiding by the province's framework with regards to the inclusion at the very end of phase one and into phase two, medium priority healthcare workers. And I have heard the criticism that these are individuals who don't work directly with the public, and that others potentially should be receiving the vaccine before them. The rationale for including them would be that they are also necessary to maintain the healthcare system, to operate hospitals and other healthcare settings. And that if we are to protect those services, we need to make sure that those individuals don't become ill or part of an outbreak. But I think that there's room for, I think, critical review, and there's always, I think, going to be room for people to be concerned about the prioritization. No prioritization document is going to be perfect. Do we have concerns about COVID-19 spread during the upcoming spring school break based on the case counts in Simcoe, Muskoka? Should the province consider postponing again? I think that this is a good question. I think that there was certainly the potential for the province, when they postponed the March break, to postpone it even later than they did. The concern about the March break before was that we did see an increase in transmission of COVID-19 over the Christmas break related to children being at home and the social gatherings that proved to be more transmitting of COVID-19 to children than the school environment or children going to school. So I think one could make the case for postponement. I still believe it's important for us to keep school going if we can. I do note that we are into the third wave, and it may prove to be not feasible to keep school going if third wave becomes quite marked and severe, because of with that you would get a substantial number of teachers and children becoming cases through their contact in the community, and resulting in exposures in schools that would be such large numbers that it would be hard for schools to operate. So I note that potential, but I believe at this point in time it's an important thing to keep school going. And I do note that if we go on a break right now, you might end up with that surge. So I personally would be supportive of a further postponement, but would also note that we might find with the third wave that we would have to be discontinuing school regardless. What is the plan to vaccinate folks who are physically unable to leave their homes? And so I've already touched on the fact that we are commencing immunization of individuals who are housebound. We've identified some 800 of them to be immunized in the weeks to come. Red zone rules state those dining indoors may only be seated with members of their same household. Who enforces this restriction? Are restaurants required to check this? And restaurants should be asking about this. Certainly as a health unit, we can respond to any violations of this nature. We would take an educational approach with this. And really, I think it would come down to attestation of individuals indicating verbally that they are members of the same household, and that would have limited, there'd be limited ability to verify that. It would require public trust. It's important that people abide by this because this helps reduce transmission between households. It really goes back to us advising that people stick with their own households for close contact. Will the changes made to the gray or lockdown rules allow more businesses to stay open in some capacity have an impact on your decision-making about advising the province to put Simcoe Muskoka into stricter restrictions going forward? Would it make the decision to request a move to gray easier? What I would say is that it doesn't necessarily make it easier. I think it reduces the potential effectiveness of a lockdown. If you have a gray lockdown that is more permissive of movement of the population and interaction of the population, you're more likely to get transmission than if it were more restrictive. At this point in time, fortunately, we've been actually maintaining somewhat of a plateau in red, around or below 50 cases per 100,000 population. So certainly we're not at the point where I'd be recommending moving into gray. I am actually more concerned about where the province as a whole is going. I note that the provincial rates are considerably higher than ours, that there are many more areas of the province that are in red or potentially moving into gray. And that if we end up with a continuation of the transmission pattern that we've got, that the province may need to move into more of a broad regional shutdown, but we shall see. So some further questions. How do I know my online booking was successful? So when you are booking on the provincial site, you will get, first off, a confirmatory message on the site indicating that you've got your appointment. It'll indicate the dates and times for both your first and your second appointment. The last screen that you will say you will have will say your appointments are successfully booked, and you will get a confirmatory email as well. So you need to be looking for all of that. Why can't I get my second dose sooner? So this really comes down to the province's change in direction, requiring that people wait up to 16 weeks for their second dose. This makes it possible for us to reach many more people to provide them with their first dose. And we know that first doses are highly effective. And through this means, we can reduce transmission and save lives. There are certain exceptions to this, people who live in long-term care facilities, those who have certain health conditions, and Indigenous populations living remotely. But other than that, the great majority of us will be waiting for our second dose 16 weeks. And this is meant to save lives. Do I need to wear a mask and stay home if I've been vaccinated? So by all means, we want everybody immunized, fully immunized, but even taking the first step with a single dose is very important. However, at this point in time, we are not recommending that you discontinue any of the other control measures. This is an added benefit, but there's still a high degree of transmission of COVID-19 in our communities, and we need people continuing to do precautions with the use of masks, physical distancing, hand washing, and avoiding gatherings.
Okay.
And so at this point, I'd be happy to take questions or comments.
Thank you, Dr. Gardner. We have quite a few reporters on the line today, so we're going to start with James Bowler from Cogeco, please.
Hi, sorry about that. Hi, Dr. Gardner. Just a quick question about the rollout of the vaccines. I had an opportunity to speak with the provincial medical officials on how the rollout was happening, and especially in Simcoe, Muskoka, if we were able to move ahead of the province. It looks like we are, in terms of the email we got last week saying 70 and older could set up for vaccinations ahead of time. In terms of the trajectory we're moving at right now, when do you see us moving into the next stage of vaccinations, the age group wise?
I think we need to be cautious about that. We've had our clinics well booked up, and I think what we see of the projections are that we're plateauing in terms of the volume of vaccine. We're not going to see for a while, potentially late in May, a large increase in the volume of vaccine that would be coming to us. So I think we're just going to have to wait and see. At this point, I wouldn't want to forecast on that.
And just on the Premier's message about Easter, he did hint that there might be bigger ramifications coming. Again, do you support the idea of moving back to a shutdown of the province in order to try to curb this, what appears to be the third wave moving through at this point?
When I look at the numbers, more so beyond our boundaries than in our boundaries, they're headed in that direction. I see overall in the province a very high rate of transmission. We see a high percent positivity. We see very high utilization of ICU beds and hospital use in large urban centers in the Greater Toronto Area, and a rapid increase. We certainly are aware of the variants of concern. They appear to be indeed more transmissible and affecting people more severely at a younger age. I believe that it will be needed, actually.
Thank you.
You're welcome. One thing I would add to that is it also certainly gives us the opportunity to move forward as quickly as we can with the supply of vaccine and vaccinate people and get ourselves in a safer place as well.
Thank you. We're going to go on to Mark Claremont from Muskoka today, please.
Thank you. I just noticed that the deaths are down, are trending down, certainly 132 in 2021 of the 195, I think you said. Is that seems like a pretty positive thing to me? Now, we may end up with just maybe less than 10 people this month as of tomorrow.
I gather your question would be why, or what do I make of that? Or?
Well, yeah, I guess you're happy that there's fewer people dying of this, right?
Yes, indeed. It's a great blessing that we've had a dramatic reduction in mortality, and we're not alone at all. In fact, it's been noted by the provincial science table on COVID-19, in particular in long-term care facilities where they've had about a 95% reduction in mortality. And I would attribute vaccination to that. We've been successful in vaccinating the great majority of residents in long-term care facilities and retirement homes, as well as the majority of their staff and their essential caregivers. And that has finally created the ring of protection that we need for that very vulnerable sector of people. That's where throughout the pandemic, we've had between 60 and 80% of our deaths. Now we've been able to protect them. So what remains, of course, is the great many people who are vulnerable in the community, and we're doing all that we can to reach them as well, starting with those that are older and going from there.
My other question is regarding the vaccines there. We've certainly witnessed up here in Muskoka that they're talking about, or at least in Huntsville, they're opening up the arena side to larger spaces there. And I understand they may do that in Bracebridge at the arena also from the high school. What do you make of the, are you going to keep the dual booking system going with the province?
Okay, so two questions there. What do I make of moving to an arena? If it increases capacity, that's a good thing, because I do believe eventually we're going to end up with a much larger volume of vaccine, and then we're going to be using up all the capacity and moving as fast as we can to vaccinate everybody. Okay. Sorry, repeat your question again.
And then the second one was also about the, what was it? I can't remember myself there. I having one of those moments. Cases, the dual
booking system. Yeah, that will have to continue, I'm afraid. And the reason for that is because the province's booking system is for, at least to date, age-based bookings only. So now they are accepting bookings for 70 and above in our district, but there are other people who are eligible based on other criteria. And what they want from us are curated lists in which we've got the required contact information on those people and some kind of assurance that they are, in fact, in the priority groups that we need them to be in. And for that reason, we are maintaining our pre-registration booking system on our website, and also the capacity for people to phone in to be pre-registered. So we receive that information and submit it to the province, and then it ends up in their booking system.
Okay, thanks very much.
You're welcome.
Mary Beth Hartle from Muskoka Today, please. Excuse me, Metroland. Yeah.
You got it. I'm just, over the last 24 hours, I'd say, there's been a number of concerns about the people trying to book in Bracebridge and are unable to, some of which are opting for Huntsville. Do we know whether there's some sort of glitches going on with Bracebridge, or do we know why it is that people aren't able to book?
What has happened is there are certain locations in which we booked right up until the 16th of April, and Bracebridge is one of those locations. So we are uploading onto the province's system the ability to book beyond that date now, but those are locations that are otherwise have been popular for booking. People certainly are free to book in other locations in Simcoe, Muskoka if their first choice isn't available, and they want to do so sooner rather than in those later dates. And we're doing what we can to otherwise make vaccination available through the Astrazeneca and primary care, through our mobile teams to the congregate settings. Potentially in the future, vaccination through primary care and hospitals to those who've got the medical conditions that are of priority coming in phase 2. But when it comes to that particular site, it's booked up until the 16th.
Okay. And then a follow-up to that, then, out of the family health teams, how many of those are in Muskoka?
You have one family health team. Off the top of my head, I don't know how many practitioners are receiving vaccine within that family health team. And I do know that we've also provided some additional vaccine to some local practitioners beyond the Astrazeneca. So we did provide some to some family practitioners in Gravenhurst.
Okay, perfect. Thank you very much.
You're welcome.
We'll go to Brett Glover from Barrie 360, please.
Thank you, Leslie, and thank you, Doctor. I'd like to circle back to some of the recent lives lost to COVID in our region, and I know that there are folks of an age at which vaccines would have been made available. So I really have to ask if you could tell me if any of the recently deceased were immunized prior to their death.
I've actually asked my staff to get me that information. I don't have it at my disposal, but that is one thing that I really want to focus on going forward in the future, the potential for vaccine failures. So I don't have the answer to your question.
But you'll have one next week, perhaps?
I hope to.
Okay. Thank you. As well, a local school board has told us of significant staffing shortages after the province tightened the criteria by which people should stay home from school settings. Do you think this criteria is now too strict or a necessary evil?
It's probably unavoidable, and it would challenge the ability of schools to operate. And so as you get into more of a third wave, it could very well force ultimately closure of in-person education for a time.
Thank you very much.
You're welcome.
We'll go to Mike Arcelides from CTV Barrie, please.
Doctor, hello.
Well,
supply issues. Are we experiencing supply issues right now with regard to vaccine? We're hearing that in the next week or two and possibly next month and a half, we could be seeing a major dip. Is that what you're hearing as well?
what we've got is basically flatlined in terms of vaccine we're receiving, vaccine that is projected out 6 weeks and beyond. So not an increase, essentially, and that's disappointing. We were hoping to continue to get more and more of it. We certainly have the capacity in our system to be able to take a lot more.
With regard to the threat right now that we have been facing since the beginning of this pandemic of overloading the healthcare system, are we getting there right now?
I believe provincially we are. I believe locally we've been fortunate in that we've somewhat plateaued in our cases, though we're starting to see an increase in hospitalization here locally. That's always a worrisome sign. And we could very well see our weekly case count take off as well as it has elsewhere in the province. So provincially speaking, I believe we're getting there.
So what do we attribute this rise? Is it the variants almost alone? Because obviously the weather's getting better. You're seeing more people out. Is this a direct correlation with the reopening of the economy and folks carrying on and saying, you know, to heck with this, we're done with the pandemic?
Well, I do believe that we did reopen when our rates were still quite high in the range of 1,000 cases a day, 1,000 cases a day across the province and 20 deaths when we reopened. And the variants of concern were definitely starting to take off, in particular here in Simcoe, Muskoka, because of the large institutional outbreaks that we had. So those two factors would work against us. And the control measures that exist have been relaxed as well. The contents within the framework have been further relaxed. And there might have been more of a reliance on the ability to vaccinate people, but we aren't getting the volume of vaccine fast enough to be able to race ahead of these variants of concern. I feel confident that we will eventually get to the point where the vaccines have taken hold. We've covered enough people that they win out and we gain control, but I think that's going to take us several weeks to achieve.
So we're losing this race right now?
I believe we are at this point in time.
What is your message to folks who are saying, look, I'm getting the vaccine here. I'm good. I'm protected. I'm going to carry on with my life. Not so fast, right?
People need to continue to be cautious. We're not recommending that you relax the control measures, even if you are immunized. And very few people are fully immunized because of the 4-month waiting period that's now required until you get to your second dose. So you don't have as much protection as you will when you get your second dose. That's needed to protect more people. Ultimately, it'll achieve a greater good, but it contributes to the rationale for people as individuals needing to continue to practice physical distancing, restrictions on gatherings, not having people over, wearing a mask when you're in indoor public places or workplaces.
Thank you.
You're welcome.
Okay, we're going to go to Chris Simon from the Barrie Advance, please.
Thank you very much. Dr. Gardner, obviously there's been a lot of talk about the safety of the Astrazeneca vaccine. Have there been any issues, any complications involving local residents with any of the vaccines that have been distributed around here?
Well, we do monitor for adverse events following immunization. We've not had severe incidents. We've had minor reports that we have provided to Public Health Ontario as required, and that includes Astrazeneca. So my understanding is that there haven't been the thrombotic, clotting, bleeding phenomena in Canada that has been noted in Europe with AstraZeneca.
And my other question is just around, is there a number? Obviously, hospitalizations are going up right now. You've talked a little bit about the saw blade overall case numbers, but is there a number that you're looking at right now that maybe has you particularly concerned that we could be on the edge of further restrictions?
I think more regionally about that now, rather than just my health unit. I think when I think back to our response to the pandemic, we've been most successful when the entirety of the province has moved in a direction, used a lockdown, a shutdown. That worked in the spring last year. It worked in January and February this year. So I think in terms of what's the province as a whole doing, and the province as a whole is certainly heading in the wrong direction when it comes to cases and rates and hospitalizations and ICU admissions. The only thing that has been improved greatly is mortality. That's a very good thing, but that's because of the protection of long-term care. Locally, we've got this plateau so far of our case count, though the last week was the upward swing of that sawtooth pattern. And the other thing I note is that we're having an increase in our percent positivity, which can be an early warning that things are going in the wrong direction. Also, the complexity of cases, the number of contacts per cases. My case and contact management team have noted that too has increased, which means more contacts per case means potential for more transmission.
And just one last question, if I may. I'm curious to know whether or not you've seen any cases in Simcoe, Muskoka of reinfection, someone who's gotten sick, then gotten better, then caught the virus again.
We've not really seen that. We've seen incidents where the picture was a bit confusing with the laboratory testing because of an infection in the past, and when we get a test result, it's marginally positive, and then we have to interpret whether or not it's a true lingering positive result or just an irregularity of the test because they've been positive in the past. So we've not had documented true reinfection.
Thank you.
You're welcome.
All right, we're going to go to Marg Bruneman from Barrie Today, please, Marg. Are you with us and unmuted, Marg?
I was not. Now I am. Sorry. Thanks for the ability to ask the question. Can you, Doctor, talk a little bit more, expand upon the use of the primary healthcare teams locally for the distribution of the vaccine? You suggested that program will be ongoing. Is it an expansion upon the pilot program, or will that roll out to be something bigger than just the 60 to 64 age group?
So I anticipate that it will be 60 and above. Given what restrictions are on AstraZeneca right now, I do not anticipate that it would be 55 and below, although it's possible that could change too with further review of the evidence by Health Canada, but of course we need to follow their lead on that. With this second installment of vaccine, in addition to the 9 family health teams, there are 2 community health centers, one in Barrie and one in Muskoka Beach, which will be joining in providing immunization. We don't know how much vaccine we're going to be getting. It would be nice if we get more, but we just don't know at this time, and we don't know how frequently we'll be getting it.
My second question is around pharmacies, given that it looks like we're plateauing on the supply, in other words, not increasing for the immediate future. Is there an expectation that Simcoe Muskoka pharmacies will be able to distribute the vaccine, or is that more of an on hold given the plateau of the availability?
So that vaccine is supplied independently of what we receive in public health, and it doesn't go through public health. It goes through their own distribution chain. So therefore, it would be a way for us to get more vaccine in Simcoe Muskoka. Incidentally, the Astrazeneca vaccine too it goes through us. The vaccine that goes to primary care goes through us, but it's an additional amount that we would be receiving.
Thank you.
You're welcome.
All right, we'll go to Erica Engel from Collingwood Today, please, Erica.
Hi, Leslie. Thank you. Also, just so you know, Jessica is not on the call, so you don't need to ask her. Dr. Gardner, during the second wave, Barrie, I believe RVH, was asked to take on some patients from other regions that were experiencing higher volumes of hospitalizations. I'm wondering how the current situation compares to the time when Barrie and other Simcoe hospitals were asked to take in extra patients. Are we getting close to that again?
I believe we are. We may already have been. I don't have details on that, but I'm asking my staff to ensure that I do have details on that going forward, because it was certainly important in the second wave. Both RVH and Soldiers Memorial Hospitals received patients from the GTA. And my understanding is that it's a similar situation evolving right now in the Greater Toronto area.
Okay, and then my last question is, I wonder if you've seen any cases that can be traced to any of the protests, whether the ongoing ones in Barrie or the one-time ones in other communities.
That's a good question. I'm not aware of any specific incidents in which they're able to pin it to that type of thing. But it's a good question. I think I'll specifically ask my staff if they could look out for it. It might be a very difficult thing to determine because it would fall in the category of community transmission, where somebody doesn't know for sure where they got it, and there's nobody in their life that they know of who has it, and yet they've acquired it as a case. But specifically asking about attendance at protests it's a good idea. Thank you for that.
Okay, thank you. We'll go to Dawn Huddlestone for the Huntsville Doppler, please. Are you still with us, Dawn? Okay, we'll go down then to Adrian Prokovic from MyFM. All right, I know she pops off for the news. Have I missed anyone on our list that would like to ask Dr. Gardner a question? All right, Dr. Gardner, I think we're finished for today. Thank you everyone for joining us. And a reminder, our next briefing is on Wednesday, April the 7th, and hope everyone has a safe and healthy Easter break. And thank you very much for joining us.
Bye, everybody.
Thank you.